Good afternoon, this is Dr. Dale again. This video is alphabetic list of problems. We're on letter C. I am going to talk about congestive heart failure today. First of all, let's start what kind of signs that warrant emergency visit. What kind of problem you need to see the emergency right away. Usually, I'm going to talk details, but usually the right heart failure and left heart failure, relatively the left heart failure is more severe because the fluid back up to the lung, then impaired respiration, cannot breathe. So these are the signs, like you feel severely difficult breathing, shortness breath, and with or without chest pain. You feel the lips cyanosis change color to purple or bluish, and you during night you woke up, like previously I talked about those symptoms. I talk about COPD or other diseases. So if you need to wake up, get to the window, gasping for the fresh air, and also you need to sleep on more pillows because you cannot lie down flat. These are the signs you need to see the emergency. The better, the sooner the better. If treated with the diuretics, get rid of the fluid, you feel much better in short time, unless there's some irreversible causes. Okay, so that's the emergency situation. For the right side heart failure, the emergency is one complication of the liver disease, congested liver, feel nausea, vomiting, and because the liver congestion can have the vein abnormal in, for example, the esophagus vein dilated, and might complicate as a vomiting blood. If that's the case, you need to go to the emergency. However, this is not quite common, but it could happen. So anyway, so let's talk about detail about the congestive heart failure. So there could be the left and or right, or eventually, regardless left or right, most of the case will be pan, the whole heart failure if not treated properly, not treated on time, or if it is irreversible. So what are the causes for the congestive heart failure? The common cause of left side congestive heart failure is hypertension. It makes sense because I previously mentioned your heart needs to constantly working harder than normal to overcome the elevated blood pressure from the aorta and also the peripheral resistance. So that's one of the most common cause for the left heart failure. And there's some other like a valve disease and also can cause it. And the right heart failure is commonly caused by the same thing, the pulmonary hypertension. Is not quite common, but it could happen. And the valve disease, like pulmonary valve disease or tricuspid valve disease, and or the lung disease, for example, the fibrosis, interstitial lung disease, if a long-term elevated the pulmonary pressure can cause this right heart failure, regardless both either right or left. Or COPD, for example, the right heart failure is kind of transient, eventually becomes left heart failure and pan cardiac failure. So these are the causes. What are the symptoms compared to left and the right heart failure? For the right heart failure, the fluid back up in the body, so the edema, extremity edema, and the internal of the ascites in the abdomen, and the congestion, the fluid back to the internal organs, for example, the liver and the spleen. So these are the right heart failure symptoms. Usually, like I said, if it's not a chronic, if it is not a recurrence, just the first time right heart failure, it's not as urgent as to left heart failure. However, if not treated on time or not treated or properly, can develop pan heart failure, which means left and right both heart fail. So this is the symptoms for the right heart failure. The mechanism is because the right heart failure, the fluid cannot back to the heart. Okay, so that's just the word, common word, non-medical word. So then accumulate in the body. So that's the congestion of extremities and internal organs like liver. And the left heart failure, on the other hand, since the blood back to the left heart is from the lung, circulation in the lung. So if the left heart failure, then the lung will have the fluid back up to the lung in order to go back to the heart. So that's the situation I just talked. It's urgency. It's very dangerous. Has to you feel dyspnea, chest pain, or may not have chest pain, dyspnea, hypoxia, and sometimes can cough up the pink foamy sputum because of the oxygen and with some blood in there. So it's kind of bubbling, small, filmy, and pink. That's the sign of left heart failure. So this is the compare the causes and the symptoms and the treatment. Pretty much, of course, treat the causative disease, high blood pressure, continue to treat it, or if it's a valve disease, the surgery, or if it's the pulmonary hypertension, which is really not easy to treat, but just symptomatically manage, like for example the fibrosis of lung. It's not easy to treat, probably steroid or just symptomatic manage to decrease or slow the progress for the heart failure. So this is the heart failure of this very non-medical term explanation. In terms of treatment, like I said, in addition to treat the causative disease and manage the fluid, get rid of the fluid, limited salt, limited fluid intake, and also use diuretics to promote the fluid excreted from the kidney outside of the body. So this is a very superficial touch of the congestive heart failure. Is non-medical term, and of course there's no way you can manage at home. You either call emergency or call your physician, and the physician will do the test. The first one needs to be diagnosed. There's a test in lab test for special nitropeptide, or the echocardiogram to evaluate your left ventricle functions. Ejection fraction, for example, there's a 40% or higher. You make sure that indicates your ventricular function is okay. So these are the fundamental, very superficial, non-medical explanation for the heart failure. Again, this disease has to be managed either emergency or go to emergency or see your physician. Different physician has different preferences, but there's a guideline, usually generalized practice, what kind of procedure go on to treat congestive heart failure. So regardless, you cannot manage at home. However, you can prevent. If you know you have hypertension, if you know you have a pulmonary disease, then I'm sure your doctor already talked to you. Limited salt, limited fluid, and taking the blood pressure medication to maintain normal blood pressure. COPD, of course, use the inhaler to dilate to slow the progress. So this is the again. In general, of course, losing weight, lifestyle, and decrease the stress. These you already know. So that is for congestive heart failure. Again, it's very superficial, non-medical term. I'll just explain to you, and hope it helps. Thank you for watching. I will see you next time.